Are you aware that last year in 2025 we had more cases of measles in the United States than we've had since 1992? Measles was declared eliminated from the United States in 2000. So what's happening here? I know what you're thinking. Another podcast, another video about measles. Well, yeah, but it's a little different here. This isn't just telling you what you probably have already heard about how many cases there are now in South Carolina, how measles is now spreading into Utah and Arizona. It continues to spread in Texas and many other states. It's not about that. What I'm trying to do is convey to you vaccines against measles are proven to be effective and even more effective when every child gets their vaccines on a timely basis. Here are some facts about measles that you should know. It is highly contagious, one of the most contagious viruses known. For every person who contracts measles, they will spread it to 12 to 18 people. Compared to things like the common flu, who spread it to 1 or 2 people, you get an idea of how contagious this is. And what makes measles even more challenging when you get the disease is that you can start spreading the disease days before, 3 or 4 days before you even realize you have the disease, because you don't have symptoms yet. So you're walking around infecting people, particularly when the cough starts, where those droplets that are coming out of your mouth can directly infect somebody. But even more, get this, if you cough in a certain place, those virus particles will contaminate that area, and up to 2 hours later, somebody can walk in and still get infected. That's a challenge. And why is measles spreading? Just small drops in vaccine rates for children has a huge impact, and this is why we're seeing measles again. Yes, I've heard people say that, well, when I was a child, I got measles and I did fine. Yeah, the truth is most people, will get cough, runny nose, conjunctivitis, or red eyes, and maybe some people will get the rash, and that's it. We also have another side effect that's rare, but it can happen, and it does happen, where you get encephalitis from measles or swelling of the brain. Talk to your doctor, talk to your pediatrician, look at the research, ask them. It's good to ask those questions, but understand that decades of research have shown that this is a very safe vaccine. Yes, there's always a risk, but those risks are far outweighed by the benefits. And what are the benefits? Once you get the 2 doses of the vaccine early on in life, you're not only protecting yourself, but you're protecting the people around you. You're also helping not only your children from contracting this disease, but you're helping the children that are in your child's school, in that community. You're helping infants before they can get the vaccine. That first vaccine is recommended at 12 months with some rare circumstances, like right now, maybe it's recommended a little bit earlier to stop the spread. But for the most part, children recommended get that first vaccine 12 months, and that puts the youngest, the infants, and children under a year of age at the biggest risk of getting this. And they are the ones that can suffer the most, be hospitalized, develop pneumonia, or even die. It is a serious disease. So I implore you, if you care about the children in this country, starting with your own children and those in your community, please get them vaccinated against measles.